Chapter 25, Oral Anti-Diabetic Drugs. Chapter 25, a list of objectives for oral anti-diabetic drugs. Oral anti-diabetic drugs manage type 2 diabetes. Typically, 2 or more different types of medications are used for best control. Type 2 diabetics on occasion may need insulin injections. The goals are to normalize blood glucose levels, reduce blood fat levels, and normalize body weight. There are 5 major classes. Over time, diabetes may progress to a point where not enough beta cells remain and insulin therapy becomes permanent. Regardless of what drug or drugs are used for type 2 diabetes, the best control occurs in combination with medication, diet, and exercise. These lifestyle changes can be hard for the patient to make, but will in the long run help reduce the risk for complications. Sulfonylureas stimulate pancreatic beta cells to secrete more insulin. Examples here include
glimepiride, glipizide, glyburide.
These were the first oral anti-diabetic agents, and the adverse side effect here is hypoglycemia. Meglitinide stimulates brief bursts like release of insulin, usually within 30 to 60 minutes of taking the drug. Examples here include
nateglinide, repaglinide.
There is a minimal risk of hypoglycemia with these medications. They have a short duration of 2 to 4 hours. These are sometimes used in combination with other oral anti-diabetic medications. They must be taken right before meals. Biguanines act on liver to reduce release of glucose from stored glycogen. Increased cell sensitivity to insulin then will not cause hypoglycemia. There is a reduced absorption of glucose from the intestinal tract. The example here is
metformin.
Metformin does not promote insulin release. It is taken with meals for its action. However, metformin interacts with IV contrast and needs to be held 48 hours after with contrast dye. It may be taken before receiving the dye. Alpha glucoside inhibitors inhibit enzymes that break down carbohydrates down into glucose. These do not cause hypoglycemia. Examples here include
acarbose, miglitol.
While taking these medications, monitor liver functions. They must be given with meals and may be given with sulfonylureas. Thiazolidinedione increase cell sensitivity to insulin. They act on liver to reduce release of glucose from stored glycogen. Examples here include
pioglitazone, Rosiglitazone.
Monitor for fluid retention, headache, and weight loss with these medications. The intended response for antidiabetic oral medications is to maintain blood glucose levels in a normal range and no glucose in urine. The side effects include nausea, vomiting, diarrhea, and rash. The adverse side effect is hypoglycemia. Administration alerts. Administering oral anti-diabetic drugs. Before administering, check blood glucose levels. Also check to see what time the meal will be given. These medications should be given with meals. Monitor urine output and check current lab work for kidney and liver functions. Afterwards, monitor for signs and symptoms of hypoglycemia. Checking blood glucose levels, monitoring vital signs, daily weight, intake and output, and lab work for liver and kidney functions. Monitor for side effects, keep the patient well fed and well hydrated. In teaching patients, diabetes and management. The best management is taking medication, eating right, and exercising, and maintaining compliancy. The drugs control blood glucose levels. They do not cure diabetes. For pediatrics, sulfonylureas, alpha glucosides inhibitors, and thiazolidinolines are not recommended. Metformin, megalotinides are prescribed for those older than 10 years. The dose is based on the response to the drug. For pregnancy and breastfeeding, insulin therapy injections are preferred to manage diabetes during pregnancy. Older adults may have problems monitoring blood glucose levels, they're at risk for hypoglycemia, and they may have a hard time recognizing signs and symptoms of hypoglycemia or hypoglycemia. Drugs that increase incretins and amylin. These are naturally occurring hormones that work with insulin to keep blood glucose levels within normal range. There are some examples. The intended response is to normalize blood glucose levels, that there is no glucose in the urine, and to monitor weight loss, or to maintain good weight loss. Incretins are a type of natural hormone that appears in the stomach in addition to insulin. It also helps to lower blood glucose plasma levels. Amylin is a natural occurring hormone produced by beta cells in the pancreas that work with and is co-secreted with insulin in response to blood glucose elevation. Amylin levels are deficient in patients with type 1 diabetes and in patients with type 2 diabetes who are dependent on insulin, or they are deficient in insulin. Side effects and adverse side effects of incretins and amylin. Side effects are nausea, vomiting, diarrhea, and the adverse effect is hypoglycemia. Patients need to understand signs and symptoms of hypoglycemia and possible allergic reactions. These medications should be taken before meals and not after meals. These medications are not recommended for pediatrics, not recommended for pregnancy, and in older adults there's a great risk of hypoglycemia, especially if taking sulfonylurea, beta blockers, or warfarin. There's also a greater risk for infection at injection sites for those who are insulin dependent. Blood glucose may be very difficult to control due to poor eating habits.